What is rheumatoid arthritis? Rheumatoid arthritis is an autoimmune disease. This means that the body's immune system attacks and breaks down its own tissues. For patients with rheumatoid arthritis, this is specifically the tissue of the joints. This typically starts in the smaller joints, like in the knuckles of your fingers and toes. As it progresses, it can spread to the joints in the wrists, knees, elbows, hips, shoulders, and ankles. Unlike osteoarthritis, which is more wear and tear of the joints, rheumatoid arthritis attacks the lining of the joints. This causes inflammation, which can in turn damage other parts of the body, like the skin, eyes, heart, lungs, kidneys, bone marrow, nerve tissues, and blood vessels. It is found that 40% of patients with rheumatoid arthritis experience these symptoms that don't involve the joints. What are the symptoms of rheumatoid arthritis? Rheumatoid arthritis causes chronic aching pain and stiffness in the joints. Patients may notice warmth, redness, swelling, and tenderness in the joints as well. After having symptoms of rheumatoid arthritis for a while, joints can become deformed and shift out of place. They may also feel weakness and instability in the affected joints, therefore causing balance issues. There might also be a feeling of fatigue and tiredness. Other symptoms may include fever and weight loss. Patients may find that their symptoms have flares, where their symptoms suddenly get worse, and remissions, where their symptoms are suddenly better and seem to have gone away. What factors are linked to rheumatoid arthritis? Age. Age has a direct relationship with risk of getting rheumatoid arthritis. As age increases, risk increases. Most adults acquire rheumatoid arthritis between the ages of 50 and 59. Sex is also linked with risk of rheumatoid arthritis, where women are 2 or 3 times more likely to suffer from it. Furthermore, women who have not given birth are at an even greater risk. This is because it is proposed that fetal cells that are transmitted to the mother during pregnancy decrease the risk of acquiring rheumatoid arthritis. In a study conducted in the Public Health Sciences Division of University of Washington, it was found that women who had at least one child were 39% less likely to have rheumatoid arthritis than women who had never given birth. Early life factors are also found to affect risk. It's found that adults who grew up in a lower income family or with parents who smoked are at higher risk. Furthermore, genetics are linked with risk as well. There are many genes that can worsen symptoms of rheumatoid arthritis. One example is the IL-6R gene, or the interleukin-6 receptor gene. This gene causes increased inflammation, and therefore patients with this gene are at a higher risk of acquiring rheumatoid arthritis. How is rheumatoid arthritis diagnosed? In order to diagnose rheumatoid arthritis, it is beneficial to see a rheumatologist. They will do a series of tests like a physical exam, x-rays, lab tests, and a review of your health history. An example of a blood test they might do is a rheumatoid factor test. Rheumatoid factors are proteins in the immune system that attack healthy tissues. This test examines the levels of these proteins in your blood. If there's a high concentration of these proteins, then it can help confirm a rheumatoid diagnosis. How is rheumatoid arthritis treated? In most cases, DMRADs, or disease-modifying anti-rheumatic drugs, are given. These can help slow down symptoms from increasing in intensity. If an initial treatment of oral DMRADs don't work at first, biologics, a type of DMRAD that is administered by infusion or injection, can be given. Biologics are more targeted and therefore more effective. Rather than treating symptoms, they block certain parts of the immune system and therefore reduce joint damage. How do I prevent rheumatoid arthritis? Staying physically active and staying a healthy weight can help prevent rheumatoid arthritis because people at higher weights are more susceptible to acquiring it. Thank you for watching.